Hey, you guys, let's get into our daily practice questions. But before we get started, I always give my introduction and disclaimer. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, courses, tools, and videos to assist nurses as well as nurse practitioners with being successful on boards and in practice. I have been doing this since 2015, helping nurses and nurse practitioners internationally with exam success, and would love to help you as well. But before we get into the information, I always give the disclaimer that we know there's no absolutes in medicines. We treat on a patient by patient basis, right? And any questions that I provide to you guys and create are designed based on the current guidelines that are being tested on the AANP as well as the ANCC. Anything that I am teaching on practice wise and what we are currently doing in practice, I will include that and tell you that so there's no confusion. Okay. So, with that being said, let's get into the question for today. So, question number one states a patient presents to the office today with complaints of a rash to his hands, feet, and a few on his wrist. He states that he returned from a trip and hasn't been feeling well. He states that he feels sore all over and has a headache. He states that he was nauseated and vomited once. Upon exam, the nurse practitioner notes petechiae to the patient's hands, feet, and wrist. The patient is febrile. Based on these findings, what is the best differential diagnosis? Is it A, Lyme disease, B, shingles, C, Rocky Mountain spotted fever, or D, meningitis? Take a moment and tell me what you got in the comments. All right, I always recommend reading the stem of the question first so it slows you down and allows you to truly ensure that you're answering what is being asked of you. So here, the stem of the question states, based on these findings, what is the best differential diagnosis, right? So, I'll tell you, if we are trying to figure out the diagnosis, we look at assessment, diagnosis, evaluation, and treatment. That's my thing. That's my soapbox. That's how I teach. That's how I tell you to study because that's how we practice. That's how we document. That's how they test us, right? So if they're asking about a diagnosis, you got to run it back and see how the assessment is, right? What did they come in complaining about? So what is that subjective finding? What are the findings for the nurse practitioner, right? The objective findings, right? So the patient presents to the office. They're already complaining of having a rash to the hands, feet, a few on the wrist. He hasn't been feeling well. He just came back from a trip. He's feeling sore all over, has a headache, has nausea and vomiting. The nurse practitioner confirms that he's febrile. She notes petechiae on his hands and his feet and wrist as well. So what does this sound like to you? You're starting to form in your mind what is your differential diagnosis. Is it A, Lyme disease? Well, no. Lyme disease, key identifiers, that bullseye pattern rash, right? B, is it shingles? No. Shingles usually present in a more dermatological pattern, right? C, Rocky Mountain spotted fever. Yes, this is classic presentation for Rocky Mountain spotted fever, right? Rocky Mountain spotted fever, they typically have a high fever, and after the high fever, have a headache, myalgias, fever, nausea, and vomiting. With the petechiae on hand, feet, wrist, that's classic presentation for Rocky Mountain spotted fever. And then, the first line therapy for that is doxycycline. But anyway, the answer is C, Rocky Mountain spotted fever. All right, let's get into question number two for the day. Question number two states, a mother brings in her 9-month-old daughter today with complaints of fever for 2 days and states that her tongue looks different. Upon examination, the nurse practitioner notes a strawberry tongue and the patient is febrile. Based on these findings, what gold standard examination should the nurse practitioner complete? Is it A, a chest x-ray, B, an echo, C, an ultrasound, or D, nothing, just have the patient follow up in 3 days? Take a moment and tell me what you got in the comments. All right, so stem of the question states, based on these findings, what gold standard examination should the nurse practitioner complete? Again, so we need to think of the assessment and the diagnosis so that we can think of how to evaluate this particular finding, right? So the mother brings in this patient. She's her daughter, who is 9 months old. She complains that she's been having fever. Tongue looks different. The nurse practitioner assesses the tongue, notes it's a strawberry tongue, notes she has a fever. So you would be you should be thinking Kawasaki disease, right? In the pediatric community, that is classic presentation of Kawasaki with that strawberry tongue and the fever. So next you need to think, all right, so that based off that assessment, this is a differential. I'm thinking, what is a gold standard eval that I need to do? And it's an echo because vasculitis is very common. So you want to do an echo to rule this out. All right, and question number 3 for today. The nurse practitioner and the NP student are discussing prostate cancer and when a biopsy is warranted. What response is an appropriate response? Is it A, a PSA greater than 4, B, a PSA greater than 12, C, a PSA greater than 10, or D, a PSA greater than 8? Take a moment and tell me what you got in the comments. All right, so the stem of the question states, what response is an appropriate response? So they're discussing prostate cancer and when you're supposed to have a biopsy completed, right? Is it a PSA greater than 4? No, greater than 4 is when they need to be referred out to urology for further eval, right? PSA greater than 12? No. C, a PSA greater than 10? Yes, that's the answer. PSA greater than 10 is warranting a biopsy, okay? All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. We are continuing the daily practice questions, and I hope that it is helping you as you prepare for boards, exams, and school, and getting you ready, just testing your knowledge. But if you need any additional assistance as you prepare, we do offer a self-paced course that has a system-by-system approach with mini quizzes with each, various assignments to help you as you go through each system. We are about to do our next cohort of our 5-week intensive review. Be on the lookout of the next one after this one is complete. And we do offer our one-on-one sessions. And this is designed based off of your needs. So if you are weak in an area, say anemias are your weakness and you need assistance with that, we can spend time during your session making that weakness your strength. But our most common is the custom package, where we work to bring you from unsuccessful to successful on boards. So just gauging where you are, identifying your weaknesses and your exam readiness, and then structuring a study plan to get you on to success on boards. So if you need us, reach out to the Nursing Studio at 803-400-6864, or shoot us an email at thenursingstudio1@gmail.com. And I look forward to working with you guys. Make sure you meet me back here. Happy studying. Bye, y'all.